my name's Adam. I'm a physical therapist with Therapia. I've put this video together to help you with rehabilitation following a total knee replacement. Undergoing joint replacement surgery can seem daunting, and a lot of patients have anxiety about the process. But rest assured, people who are prepared and committed to the rehab process generally do very well and are happy with their new knee. It's a good idea to be as prepared as possible a few weeks before you have surgery. This will make your return home easier and more comfortable. Here are the things that you need to consider before you have surgery. The first thing you need to do is to select your ideal physical therapist and book an appointment with them prior to surgery. Ideally, this appointment would take place in your home. That way, the therapist can make recommendations that will help you make the transition from hospital to home easier. The objectives of this session are to set your rehabilitation goals, to learn to physically navigate your home after surgery, to make necessary small modifications to your home, and to learn about equipment that you can rent or buy to make the transition home easier. What does success look like to you? While some patients just want to be able to walk short distances without pain, others want to return to sport or fitness activities. It's important that your therapist understands your specific goals to be able to tailor your treatment plan accordingly. It may be necessary to make some subtle changes that you may not have thought of. Some patients will make it possible to be on one floor of their home for the first couple of weeks, giving them a little more time before they have to regularly tackle stairs. Some furniture may need to be moved around so that you can get around your home with a walker. A few small devices can make your life easier in the first couple of weeks. Things like a shower chair, a raised toilet seat, and pain management tools like a game-ready cryocompression device will help make your recovery smoother. Before you leave the hospital, it's important that you understand a few key things. The first is to learn a basic set of exercises that help prevent blood clots and begin working on your range of motion. Next, you need to be able to walk with a walker properly. You also need to understand what pain meds have been prescribed and how to use them. And lastly, you need to know how to properly care for your wound and recognize any possible signs of infection. Most people are discharged as soon as they've demonstrated that they'll be safe at home. Some patients who are a little older or who have more significant physical challenges may be sent to a rehab facility for a few weeks prior to going home. Once you're discharged home, your home physiotherapy should begin immediately. Your therapist will put together a treatment plan that focuses on improving your mobility around your home using your gait aid, addressing any specific challenges that you're having navigating your home, treating pain and swelling, beginning to restore your joint range of motion, and lastly, beginning to work on strength of the muscles that control the hip, knee, and ankle. This phase of your rehab is when you'll be working hard to get your strength and range of motion back. It's important that you regain full extension within the first 3 weeks. Most patients can achieve approximately 100 to 110 degrees of flexion within 6 weeks. You'll also be weaned off of your walker and begin to learn to walk normally with your new knee. When you have most of your range of motion back and are walking unassisted, phase 3 can begin. During this phase, your therapist will put together an exercise program to restore all the basic functional movements you require in daily life. Something like getting up off the floor or picking up small objects may still be a challenge. In this phase, your program will focus on restoring normal functional movement patterns, improving your balance to prevent falls, and continuing to work on your strength and muscular endurance. For some patients, the end of phase 3 will mark the end of their formal rehab process. If your objective was to return to activities of daily living, you may have achieved all of those goals at this stage. For patients who have loftier goals, phase 4 will begin. The fourth and final phase of rehab is different for every patient because it's designed to return you to exactly the activities that are most important to you. Your physical therapist will be able to put together a treatment plan that will bridge the gap between your current level of function and where you want to be. Throughout your rehab, be sure to share any concerns that you have with your physiotherapist. Some signs of trouble that may require a doctor's visit are increasing pain despite no increase in activity, any redness, swelling, pus, or discharge around the surgical incision, the inability to bear weight on the affected limb, and the inability to achieve full extension in the first few weeks. If you sustain a fall during your rehab, be sure to have the joint examined and make sure no damage was done. Now that you know what to expect, it's time to get to work. With a little prep and some help from a great physical therapist, you'll be back to pain-free living in no time. At Therapia, we have the experts that can help make your rehab journey as easy as possible. Give us a call and we'll help every step of the way.